Hello and welcome to our online fertility awareness program, You and Your Fertility. This series is the 20 Steps to Pregnancy series, and today we are in episode 9, and we'll be talking about the impact of alcohol in the fertility process. So what role does alcohol play for someone who is trying to conceive or who is trying to get pregnant, both for the male and for the female? This is not just for one party. So generally we know that alcohol is a beverage that people say do not take if you're trying to get pregnant. Do not take alcohol if you're pregnant already. Why is that? Because I know that there are probably a lot of people who enjoy alcoholic beverages and then they are told not to drink because they're trying to get pregnant. Some try it for 1-2 months and then they just like, after all, they've not even gotten pregnant. So, but what negative effect does alcohol have on the reproductive system that makes us say don't drink if you are trying to conceive, if you're actively trying to conceive, or don't drink when you are pregnant? So alcohol interrupts some of the metabolic processes in the body, especially when it comes to the reproductive system, and then it has impact on the male and the female as well. Unfortunately, it has more impact on the female. Alcohol has more impact on the female for the following reasons. So one is that women are generally smaller in size than men. Men are usually bigger, have more girth, more weight, more muscle mass than women. Women tend to have more fat tissues than muscles or bone mass as compared to men. So the quantity of alcohol a man would drink, if a woman drinks that same quantity, it will impact more on the woman. It will have more effect on the woman because of the woman's size generally. And then even if a woman has the same weight as a man, another reason is that we have more fat cells, and alcohol is water soluble. Alcohol is water soluble. When you take alcohol, it dissolves or it stays in the water body or body water as it were. The water in the body is where alcohol concentrates. And because women have more fat than water compared to men, we find out that the quantity of alcohol in the smaller amount of water we have becomes more concentrated as compared to men. So men have more body water than women. And when we drink the same quantity of alcohol that a man would drink, it will be more concentrated in the woman's body because the water in the woman is smaller. And so men can take alcohol and will not have so much effect as it would have on the woman. So these are generally the reasons why we ask women who are trying to conceive to, as much as they can, stay off alcohol. We have said that it tampers with the metabolic processes. We have said that it concentrates more in a woman's body. But what exactly does it do to the reproductive system? So alcohol generally disrupts the entire menstrual cycle of a woman because it can interact with hormones, it can interact with normal body chemicals. We sometimes talked about the impact of chemicals on the system. Alcohol can be like a chemical, so it can disrupt the entire menstrual cycle for a woman. Generally, alcohol can also have other impacts of other negative effects on the woman. It causes increased rate of osteoporosis, that is bone loss. It increases menopausal symptoms in women, that is those who are already attaining higher ages, getting closer to menopause. It's kind of hastens the menopausal process or intensifies the menopausal symptoms in such women. Unfortunately, alcohol also increases the risk of breast cancer in women. So all these reasons are why we say women should, as much as possible, reduce alcohol intake to the barest minimum. And if you are trying to conceive because you want your menstrual cycle to be as it should be, you should stay away from alcohol completely. So quit alcohol if you're trying to conceive as a woman. If you're already pregnant, alcohol can cause what we call alcohol baby syndrome. It reduces the baby's size, tampers with the baby's brain development, and generally impacts negatively on the general health and well-being of the unborn fetus in the womb. Okay, so men are not left out. What does alcohol do for a man who is trying to achieve pregnancy with his partner? Alcohol generally reduces the level of testosterone, which is the male hormone in the body. So when a man is a heavy drinker, it reduces testosterone level in the body. Alcohol also impacts negatively on the production of sperm cells. This is because the liver, which metabolizes alcohol, also metabolizes vitamin A. Now, the metabolism of alcohol prevents the metabolism of vitamin A, which is an essential ingredient in the production of sperm cells. So when a man is short of vitamin A as a result of poor metabolism because of alcohol consumption, he inadvertently reduces the production of sperm cells. And also, even when the cells are produced, alcohol can reduce motility for sperm cells. So there are three things that it does to affect men negative and male fertility negatively. Reduces testosterone, reduces sperm production, and also reduces motility. So with these points, you can understand why we are saying if you are trying to conceive, quit alcohol. Also, you need to quit illicit intake of drugs. By drugs, I mean even chemotherapeutic drugs. So drugs that are not prescribed are chemicals still. So don't just take drugs, don't self-medicate, don't take drugs just anyhow you want, especially if you are trying to conceive. All those things are chemicals. They have their impact or their effect on the reproductive system, can tamper with their functioning, and yes, maybe by a long shot can affect your chances of conceiving. We hope this video has been helpful. Hope you've learned something. Please like, share, subscribe to our YouTube channel at love_foundation. Follow us on Instagram at love_foundation_. You'll find a link to this video in the post after now. Thank you for staying with us. See you next week with another interesting topic. Bye bye.